guys, I'm Sarah and welcome back to Music Therapy with Sarah. Today is Thursday and I will be answering the question, what does a typical music therapy session look like? So I'll be pulling in examples and experiences from my internships and working professionally as a music therapist, a total of 3 years of my life, and I hope I continue to learn going forward. Anyways, so with older adults, let's start with older adults end-of-life palliative care. So with those patients, music therapy session can look like receptive music therapy, receptive music making. So usually it's them laying down and listening while myself or a music therapist would provide the music or play a recording. Usually it's a lot better to provide live music, obviously. So I work with palliative care patients where I provided relaxing music for them to ease their pain, mostly on guitar and flute. So with palliative care patients, they may reach a point where they have difficulties articulating their musical preferences. So it's ideal that as music therapists, we talk to the client's family and healthcare team to get an idea of the client's musical preferences. What kind of artists do they love? Genre? Do they have a favorite song? So getting to know the client as best as we can to provide the best beneficial service. And with older adults with dementia and Alzheimer's, it can look like active music making. So singing together from familiar songs and playing different instruments such as maracas, tambourines, drums. So it's to get the clients engaged in music making, to participate, to increase socialization. So a session can look quite different depending on who we're working with and what goals we're working towards. So I'm just providing the most typical session that you may encounter. So we'll be singing a lot of familiar songs with clients with dementia, provide group music therapy. Sorry about that, it's quite loud upstairs. Provide group music therapy to get them to socialize more, engage with others, participate. So those are some of the goals that we will work towards. And it's quite amazing the results we see singing familiar songs and providing music therapy with older adults, because they remember all the words from their favorite songs. The words, the melody, just the whole song, they're able to sing it while they have trouble remembering their children's names or daily routines, for example. So music does something cool with the brain where it's quite fluid between the left and right brain, and we can't forget musically the songs that we love. So that's why dementia patients, they can remember, and it's the most typical session comprises of music therapists singing familiar songs. Now let's move to mental health patients. So with these guys, it comprises of a lot of songwriting. So writing words first and then putting those words, those feelings into music and playing together. Or the other way around, where we would improvise in the moment, play how we're feeling together, and then put those feelings, talk about how that music sounded, and put those into words. So it can be music making, then therapeutic talking, or talking, then music making. Really any order that benefits the client most. And with children on the autism spectrum, I've worked with a couple kids on the autism spectrum where we worked on self-regulation, increasing socialization. What else? It's just another modality for kids to express how they're feeling. Music therapy is a great way. It's just another modality for patients to express how they're feeling. Like art therapy, dance therapy. But the biggest misconception that I should mention is those who want to participate in music therapy, you do not need musical experiences or backgrounds. So, I'm wearing my sweater. I went to Western. Oh my god. I went to Laurier for my master's in music therapy. I went to Western for my undergrad. But at Laurier, we learn how to use the right interventions, approaches, methods to work with any and all types of clients. So don't need musical experiences or backgrounds to partake in music therapy. Okay? So if you're worried about that and you're scared or nervous about participating in music therapy because you feel like, I need to know how to play an instrument, that is not the case. Okay? So that's it for today, and I'll see you guys in a couple days for Sunday. Fun day. Bye!